Okay.
Pelvic examination. A pelvic or internal examination is an examination of your genital area and internal reproductive organs. It may be done if you have symptoms such as abnormal vaginal discharge, period problems, or lower abdominal pain. You should always be asked if you would like a chaperone present for this type of examination. You will be required to remove your underwear and then lie on your back on the examination couch with your knees bent up and the legs slightly apart or with your feet in stirrups. The doctor will wear disposable gloves for this examination and will first inspect the area around the outside of the vagina and then insert a speculum with gel on it gently into the vagina. The speculum is then opened slightly so that the inside of the vagina and the neck of the uterus can be seen. A pap smear and swabs can be taken if necessary. Finally, doctor will use two fingers to feel gently inside the vagina, with the other hands on your lower abdomen. Sometimes you may also be sent for an ultrasound scan. These tests may be slightly uncomfortable, but should not be painful. So during a pelvic exam, the medical professional will first visually examine the outside of the genitals and then view the cervix before using both hands to check the uterus and ovaries. These tests can show whether you have any abnormality in the genital region or cervix, or whether you may have a vaginal or pelvic infection. The ultrasound can show if your uterus is enlarged or has a thickened lining, or if you are pregnant. It can also check for cysts in the ovaries. Following this, your doctor may recommend further tests or treatment. Thank you for listening.
Let's now go to pathology of Qi mechanism. Let's discuss entering and exiting of Qi in organs. The entering and exiting of Qi in the organs is the way in which the internal organs influence the respective tissues. That is, the lungs is the skin, spleens to muscles, liver is to sinews, heart to blood vessels, and kidneys to bones. Therefore, the entering and exiting of qi in each organ ensures the communication between each organ and its relevant tissue. In pathology, a disruption of the entering and exiting of qi between an organ and its respective tissue leads to a pathology of the relevant tissue. Here in the tabulation, we discuss the pathology of the entering and exiting of qi between each organ and its relevant tissue. So if the organ is the lungs, the tissue is the skin, then the excessive exiting is the space between the skin and muscles will be too tight. If it's deficient exiting, the space between the skin and muscles will be too lax. Next is if the organ is spleen, the tissue would be the muscles. If it's excessive, the muscles would be stiff, and if it's deficient, the muscles would be flaccid. Next, if the organ is the liver, the tissue would be the sinews. If it's excessive, the contraction of sinews and it cramps. If it's deficient, the sinews would be too soft and prone to injury. If it's the heart organ, the tissue would be the blood vessels. Then, if it's excessive, there would be hardening of the vessels. If it's deficient, it's the slackness of vessels, like varicose veins. If the organ is the kidneys, the tissue would be the bones. If it's excessive, there would be night sweating. If it's deficient, there would be blood stasis. Thank you for your attention.
Stomach 44, nating, inner courtyard. Located on the dorsum of the foot distal to the second and third metatarsophalangeal joints, half soon proximal to the web margin. Nating, or inner courtyard, inner court, is a water point, yin spring point, one of Madanyang's 12 points shining bright as a starry sky. The stomach is the sea of grains and liquids and needs sufficient fluid to perform its responsibility of rotting and ripening. The stomach is said to dislike dryness, while the spleen dislikes damp. Without sufficient lubrication, digestion and thought processes become partially assimilated, gritty, and stodgy. Stagnation and heat can result. The resulting irritation in the system can lead to a sense of panic and agitation. You may feel mentally unable to resolve a situation and move on. Mental processing never finishes and heat clouds your perceptions. Or you feel mentally or physically too full to take in anymore, but what you have ingested isn't nourishing you. Good for anxiety around symptoms and emotions. When someone's distress and anxiety about their symptoms seems excessive to the prognosis or symptoms, or when the fear of being frightened has become more than the pain itself, the person may seem to others as if they are being a drama queen. Then Earth needs the fluid yin reflective properties that inner courtyard, nating, helps to provide. Use where there is restlessness, agitation, or lack of concentration from heat in the stomach. This agitation can lead to incessant eating or feeling that one's needs are never satisfied. Emotional instability can result, as well as the perception is that no one else supports you or attends to your inner hurt. Water, with its yin properties and involvement in the regulation of fluids, can soothe the alarm and distress of the stomach. Concentration and clear thinking can be restored as processing returns to a normal pace and consistency. The name partly refers to the location of the point. Also, indicative pathology talks of people shutting themselves in rooms, courtyards, and shunning contact with people, hating to hear human voices. Stomach 44 clears heat from the stomach channel and can be used for nearly all stomach complaints where heat features. Since heat and fire tend to collect in the upper part of the stomach meridian, the in-spring point properties of stomach 44 are called upon to clear fire. It is an excellent point for headaches in the Yangming area of the head, rhinitis or sinusitis where there is heat, sore throat due to stomach fire, indigestion, heartburn, diarrhea, or constipation due to heat. It clears pain from the face along the stomach meridian, especially the lower jaw. Good for trigeminal neuralgia, facial paralysis. It can be combined with Li4 to clear wind and pain from the face. It can be used in analgesia for toothache and childbirth, skin rashes, acne, eczema from stomach heat. Ling Shu and Shan Han Lun both describe Yangming febrile symptoms, febrile delirium, high fever. Indications for stomach 44, irritability, overprocessing, resentment, lack of concentration, agitation, bleeding gums, stomach complaints with heat. Inner courtyard is a place you can retire to get away from everyone and everything when you are fed up with life and dislike the sound of the human voice. Consider this point if the patient is overheated, restless, or agitated. Emotional response to resentment, hurt feelings, or general dissatisfaction with life can give rise to overeating but never feeling satisfied. This cooling point can be effective in these circumstances. For a swollen abdomen, trigeminal neuralgia, facial paralysis, or sinusitis. Stomach 44 is often used with spleen 9. Indications and potential point combinations. Sympathetic arousal, inflammatory disorders, especially of the face, toothache, gingivitis, oral lesions, pharyngitis, and tonsillitis. We combine stomach 44 with stomach 36, Li4, lung 7, CV22. For fever, we combine stomach 44 with GV20 and GV24.5 or in tongue. Electroacupuncture at the Sanjiao and Shenmen ear points, as well as body points Li4, Li11, stomach 25, stomach 36, stomach 44, and liver 3 may have lowered serum total cholesterol, triglyceride, and LDL cholesterol levels by increasing serum beta endorphin levels. Thank you for your attention.
Let's now go to large intestine patterns. Let's discuss large intestine deficient cold. This concept is due to yang deficiency of the large intestine. In clinical manifestations, there will be rumbling intestines, dull abdominal pain, preference for warmth and pressure. lingering diarrhea, or fecal incontinence, possibly even tenesmus, rectal or anal prolapse, aversion to cold and preference for warmth, cold body and limbs, fatigue, lack of strength, profuse and clear urine, constipation, a pale tongue with a white slippery coating, a deep and weak or deep and slow pulse. The key symptoms would be irregular bowel habits like loose stool or dry stool with symptoms of a deficient cold pattern. In this analysis pattern, it is caused by innate yang deficiency or by overconsumption of raw and cold foods or by chronic diseases or chronic diarrhea which damages yang qi. We can see here the analysis of a large intestine deficiency cold pattern. The yang deficiency of the large intestine, if cold, if damp cold accumulates inside and fails to transmit and store, there will be rumbling intestines, lingering diarrhea or fecal incontinence. If it fails to transmit body fluids due to yang deficiency or failure to discharge the waste materials, there will be constipation. When there's exuberant cold pathogen congeals qi and blood, pain due to inability to circulate, there will be dull abdominal pain. When yang deficiency fails to warm the body and limbs, there would be aversion to cold and preference for warm, cold body and limbs. If it's yang deficiency, there would be fatigue and lack of strength. When qi is deficient and qi is sinking, there would be tenesmus and prolapse of anus. If there's pale tongue with white slippery coating, a deep and weak or deep and slow pulse is symptoms of a deficiency cold pattern. To summarize, the etiology, excessive consumption of cold and raw foods, prolonged exposure of the abdomen to cold weather, probable underlying spleen or kidney yang deficiency. Possible presenting condition would be chronic enteritis and chronic dysentery. The signs and symptoms would be loose stools resembling duck droppings, dull abdominal pain, pale urination, cold limbs, borborygmi, lower back ache, poor appetite, and aversion to cold. For comparison, spleen, stomach, yang deficiency, the stools contain undigested food, there is poor appetite, oppression in the abdomen after eating. If the large intestine is yang deficient, the disease is in the lower rather than the middle burner, accompanied by diarrhea and borborygmi, and may have constipation rather than diarrhea. The pulse would be deep and weak. The tongue would be pale, thin, tongue fur. The treatment principle is to stop diarrhea and supplement qi and yang. The acupuncture treatments to be used uh, are stomach 25, which stops diarrhea and pain, stomach 36, supplements spleen qi, bladder 20, supplements spleen qi, Ren 12 fortifies spleen, Ren 6 supplements qi and stops chronic diarrhea, stomach 37 stops chronic diarrhea, liver 13 transforms stasis, bladder 25 supplements large intestine. You can also use needle with supplementation and moxa. Thank you for your relevant advice. When there is large intestine deficiency cold, it is beneficial to consume warm, cooked, or baked food. It is advisable to eat foods that have a warming energy. Baked root vegetables, stews, soups, lamb, chicken, onions, and leeks are all examples of warming food. Spices that will be beneficial are cloves, cinnamon, ginger, basil, rosemary, and nutmeg. Thank you for your attention.
We now discuss diagnosis by visceral organs. particularly liver illnesses. Stagnation of liver qi mostly results from emotional depression or pent-up rage causing abnormality in the liver's function of dispersion. Stagnation of liver qi leads to impedance of qi movement. In severe cases, it may induce gelling of phlegm or blood stasis. It can also induce abnormal functioning of the spleen and the stomach, causing their qi to move abnormally. Clinically, stagnation of liver qi is also known as the syndrome of disharmony of the liver and the stomach. There are two typical syndromes of liver qi stagnation. In one, there are distending pain in the flanks or lower abdomen, vague pain, chest tightness, frequent sighing, emotional depression, and blurred vision. Alternately, there may be globus hystericus or goiter in the neck. Furthermore, women may have distending pain in the breasts, dysmenorrhea, or irregular menstruation. Often, the pattern of symptoms also includes stomach distension or pain, vomiting, and eructation. Upward flaming of liver fire. This condition comes about mostly when a pent-up passion causes liver blockage, which in turn gives rise to fire. Liver fire can also arise when exogenous fire or heat invades the liver meridians. When liver fire ascends abnormally along the meridians, it induces symptoms of strong fire in the head, eyes, and regions along the liver meridians. Liver fire often moves sideways and induces the lodging of heat in the liver and the stomach. The typical syndrome of upward flaming of liver fire is as follows. There are dizziness, distending headache, flushed face and eyes, dry mouth with bitter taste, impatience and irascibility, burning pains in the chest and flanks, insomnia with much dreaming, tinnitus, sudden deafness, constipation and dark urine. The tongue is red with yellow coating. The pulse is taut and rapid. In severe cases, there may be hematemesis or epistaxis. Thank you for listening.
Let's now go to advanced assessment of mental health disorders. Let's discuss review of systems. Many mental health disorders have manifestations in various body systems. A comprehensive review of systems should be performed whenever possible. However, due to time and other types of constraints, the provider may be able to perform only a focused review of systems. During a focused review of systems, the provider focuses questioning on the systems in which mental health problems are most likely to have manifestations. Below is a summary of common manifestations of mental health problems. Here in the general system, so if there's sleep disturbances, the possible associated diseases and orders, there would be depression, generalized anxiety disorder, and bipolar disorder. For a symptom of weight loss, uh, there would be anorexia nervosa, bulimia, depression, dementia, and drug abuse. For weight gain, there's depression and schizophrenia. For dizziness, there would be panic disorder. Next is if the system is in the skin, the sign or symptoms would be cracked, dry skin, fine, downy hair on extremities, trunk, and face. Possible associated diseases or disorders would be anorexia nervosa. If there's abrasions on the hands from inducing vomiting, there would be bulimia. If there's dry, cracked hands from repeated hand washing, possible associated disorder would be obsessive compulsive disorder. Uh, if the system is in the eye, there would be visual disturbances or difficulty. Possible associated disease or disorder would be dementia. If it's the mouth, the sign or symptom would be tooth erosion, and there would be bulimia. If the system is respiratory, the sign would be hyperventilation, and there would be generalized anxiety disorder or panic disorder. For cardiovascular system, the sign or symptoms would be tachycardia, palpitations, and bradycardia. The possible associated diseases or disorders would be generalized anxiety disorder, panic disorder, or anorexia nervosa. For gastrointestinal, the sign, the sign or symptoms would be vomiting, if self-induced, loss of appetite, or nausea. The possible associated diseases or disorders would be bulimia, depression, dementia, generalized anxiety disorder. If the system is genitourinary, the sign or symptoms will be loss of sexual interest and amenorrhea. The possible associated diseases or disorders would be depression, anorexia nervosa, or anorexia nervosa. For musculoskeletal system, um, the signs and symptoms would be growth, arrest, and then there would be anorexia nervosa. If there's muscle tension, there's generalized anxiety disorder. If it's weakness, there would be bulimia. If the system is neurological, there would be speech difficulties, impaired memory or seizures. There would also be dementia. For disorganized speech, the possible associated disorder would be schizophrenia. Uh, if there's decreased level of consciousness, there would be delirium. Thank you for your attention.
Acupuncture for emergencies, acute sciatic pain. Acute sciatic pain typically results from irritation or compression of the sciatic nerve. This condition can cause sharp shooting pain that radiates from the lower back through the buttock and down one leg. Common causes: herniated or bulging discs, spinal stenosis, piriformis syndrome, spondylolisthesis, injury, or trauma. Symptoms: sharp pain in the lower back or leg, numbness or tingling in the leg, muscle weakness in the affected leg, pain that worsens with prolonged sitting or standing. We use acupuncture point on LI4, hip pain point, SI3, Sanjiao 3, shoulder pain 1 point, and the shoulder back point. Use acupuncture on GB 30, 34, bladder 37, 40, 57, and 60 for the pain distributed along the Taiyang meridian. Use acupuncture on GB 30, 34, 31, 33, 38, and 39 for pain distributed along the Shaoyang meridian. Use GB 30, 34, 1 Zhongshan points. Bend the thigh to tune over the middle point between the tailbone and the trochanter, plus 1 or 2 of the following points: bladder 40, 23, Paliao, bladder 60, 37, and GB 40. Use bladder 1 and bladder 67 for pain along the Taiyang meridian, GB1 and GB44 for pain along the Shaoyang meridian, bladder 1 and SI19 or the bladder 2 and GB20 points. 2 points in each group should be inserted at the same time by 2 operators. For the bladder 1 point, press the eyeball outside and then insert the needle with no pulling or inserting after insertion of the needle. The stem-type sciatic pain is usually caused by lumbar disc protrusion. The pain is from the lower back to the feet. The branch-type sciatic pain is mostly along the distribution zone of the sciatic nerve. For the treatment of sciatic pain, it is better to use electric acupuncture. Thank you for your attention.
Let's now go to fibromyalgia. Let's discuss regional acupuncture treatment for middle back and lower back. The main channels involved in fibromyalgia pain in the middle of the back are the bladder and the governing vessel. The muscles underlying the muscle channels of the bladder and governing vessel in the mid-back are as follows. Here, we can see the points of the middle back for fibromyalgia. For the bladder channel, it there's bladder 42, and then the governing vessel. The points are do 12, do 11, do 10, and do 8. The regional acupuncture treatment for middle back or the bladder. If it's superficial, it's the latissimus dorsi, trapezius, spinalis longissimus. For deep, it's erector spinae, serratus posterior inferior. For just strategic points to use, there's bladder 42, do 12, do 11, do 10, and do 8. Next is the lower back. The muscle channel influencing the lower back is the bladder muscle channel, and the superficial and deep muscles are as follows. For the bladder, there's the bladder 23, bladder 25, and bladder 26. These are the points for lower back for fibromyalgia. For regional acupuncture treatment for the lower back, if it's superficial, the latissimus dorsi or spinalis longissimus. For deep, it's erector spinae. The strategic points would be bladder 23, bladder 25, and bladder 26. Thank you for your